Let's get started because I did a very exciting topic this month. And let's just start with, what is dialectical behavior therapy?
So dialectical behavioral therapy is a cognitive behavioral therapy that was originally developed by Marshall Linehan, like you said, to address self-harming and suicidal behaviors. A lot of folks with those behaviors do have the diagnosis of borderline personality disorder. What we found over the years, though, is that this therapy is really supportive to anyone who struggles with emotional sensitivities and has difficulty managing their moods and emotions. And so it works transdiagnostically across diagnoses, so folks with anxiety, depression, post-traumatic stress disorder, addiction issues, all benefit from this therapy.
So what's nice about that is, as you say, it's really across a continuum of disorders, so that you can be very effective whether somebody is dealing with depression or, as you say, substance abuse, or would even guess a combination of any of the two.
Yes, and we work at DBT, works at teaching skills to help manage emotions and behaviors.
Now, what does dialectical mean, and why is it called that?
So a dialectic is when two opposites or two opposing things can be true, and that when you can hold that both, that there's more than one perspective, a third thing can emerge that can be really helpful. So it's sort of the nature of reality is that there are good and bad things that happen, that we can feel different things at the same time, that I might see something one way and you'll see it differently. For any situation, there are a zillion ways to interpret it. And what happens is when folks get fixed on this is the only way it can be, that they then start having behaviors that are problematic. Most people, when they become suicidal, is because they can't see any way out of the pain and distress that they're experiencing. And if they could see another side, it might shift the way that they go forward with what's happening. Same thing with relationship issues. So often, when people can only see one way, it causes interpersonal problems. And I can give you some examples.
Sure.
So, you might say, I love my kids and they drive me crazy, or I love my spouse and I want them away from me, or I want to be sober and I want to drink. And so if you can acknowledge that that's okay, that that's a normal part of life, to have both this and that, and to work with moving forward, holding both, that you can have more peace in your life. And that when we don't, that's when we end up suffering and having a hard time, and there's a lot of distress.